Everything good to go?
Yep, we're ready to go.
Okay. Well, good morning to everyone on this chilly January morning. Thanks for coming, and thanks for anyone else who is listening over live stream. I'll tell you a little bit about myself. My name is Jolene Garcia. My husband and I are members of Derry, and our daughter also goes here. I also am a physician at the Hershey Medical Center. I have training in child and adolescent psychiatry, and I was just telling some of our audience that I've been at the Med Center in one form or another for, I think this is going on my 21st year. I did med school, then residency, fellowship in child and adolescent psychiatry, and then joined faculty. So right now I am head of child and adolescent consult liaison service in the Children's Hospital and in our Pediatric emergency department. So I do consults in Children's Hospital and our Peds ED there. And just, so we're going to talk a little bit about youth mental health this morning and kind of the impact, especially the last couple of years, have had. Just to tell you a little bit about myself additionally, some of the impact that I've had personally that I think affects us all, but me particularly, I have lupus, systemic lupus erythematosus, or SLE, Sjogren's, and CVID, combined variable immunodeficiency. So it's autoimmune illness and immunodeficiency. So I spent over a year from when kind of everything shut down in our area, working all virtually and isolating at home until I was allowed to kind of, to some extent, rejoin the public as well as the hospital. So I have a little bit of an interesting view from that as well. So some of what we're going to talk about this morning, and I and invite any questions or concerns while I'm talking from anybody here as well as over a live stream, because I feel like it's a topic that is important to discuss openly. So I'm just going to open with a brief prayer. Heavenly Father, we ask that you bless our time together today. We thank you for walking with us and providing this day. Ask that my words and our discussion be led by your will. Amen. So when I think about child mental health, one of the verses that comes to mind is Matthew 19:14. Jesus said, "Let the little children come to me and do not hinder them." So one of the things that I think about is with any sort of issues for children, teens, as well as young adults, is we as adults have to do a lot of advocating and being very thoughtful and mindful because they often are not able to address or speak for themselves or advocate for their needs. So just kind of going back to my talk today, so I don't have any I'm going to be sharing non-specific professional advice, and advice isn't to be taken for any one specific case or individual, and it's not necessarily opinions held by my employer, and I don't have any disclosures. When we do academic talks, we talk about if there's any pharmaceutical or research or anything like that. I don't have any disclosures, just in case anybody's interested. When thinking about child and adolescent and young adult mental health and the pandemic, COVID epidemic that we have seen, it's been almost 2 years. One of the things, or some of the things, is that our world hasn't seen anything similar to this for 100 years. Maybe some people kind of say maybe the Spanish flu, that sort of thing. I don't think our world has ever seen anything quite like this, and quite like our world has had to sort of spring back or continually adjust to. So it's kind of been something I think that everyone in our world has gone through on some level, and it's been what we call a stressor for each of us. Maybe in different ways we've experienced it, depending on our age, where we live, our personal held beliefs, opinions, all those kind of things. It some way has impacted us. And specifically, kids, teens, and now our very young adults has disproportionately, I guess I would say, impacted them for, I think, a few different reasons. I think they're still learning why exactly that is, and hopefully research and understanding as we continue, we will know a little bit more. But there's some ideas that because of our little kids, our teens, and then our young adults, where they are in development in this very important social interactions, family connections, feeling safe and connected, and all those kind of things that need to happen as we grow from little babies on up to very young adults and into our mid-teens and then mid-20s that need to happen. A lot of those things have been disrupted somewhat or completely at certain times in the last couple of years. So we think that that has a lot to do with what's happening with what our Surgeon General, and I'll pull up at the end some additional resources and what I have up from the Surgeon General report talking about factors that are shaping mental health of our youth. So what we're thinking is this group has been disproportionately affected, including families, caregivers, trying to help take care of kids and teens. Everybody, I think, has experienced some sort of loss, maybe an actual loss of a loved one. Kids and teens and young adults maybe have experienced the loss of a primary or secondary sort of caregiver. We've experienced loss of jobs in parents, loss of social connections, loss of education, loss of structure, and those impact all of us. And to some extent are kind of traumas that we go on and live through, but we've experienced almost a couple years now of things being very different than any of us are used to. But especially as our kids and teens and young adults are going through normal development, it will impact them and continue to impact them and can be considered sort of a trauma in lives that kind of all sort of continue to carry with us. Prior to the start of COVID-19 pandemic, we were seeing rise in youth, teens with mental health, psychiatric illness. About 2018, I think suicide rose to be the second common reason for death in age about 10 to 24-year-olds, and that was prior to the pandemic. And since the pandemic, we've just seen things skyrocket. We've seen presentations to our pediatric and emergency departments for pediatric patients with mental health, psychiatric complaints just skyrocket. We've had some different things happen. Teens, children, young adults have had changes in schools. Some of them that rely on schools for support, maybe don't have a supportive home environment, even rely on different school system and schools for nutrition and things like that. Additionally, the academics, but it's one of the, is you grow and develop one of the competencies that you need to have to go on into successful adult life is social interaction. And that requires a lot of practice and practice at different age range and levels, as well as when we get into preteens and teens, our peer group becomes an extremely important part of our social support as well as our family. And a lot of our kids and teens and young adults have lost big gaps in those And we know now that looking back that's impacted them and will continue to impact them. And ultimately our families, our loved ones, lots of people, and our communities in the way we shape and the future of our communities and our world will continue to be an impact. So one of the things that some people will ask or talk about are red flags, especially when talking about our children, our teens, and our young adults, like psychiatric, mental health, kind of red flags. So I have, hopefully some people will volunteer, either live streaming or in the audience. Possible red flags. Anybody have an idea of what to look for when you're thinking about a red flag or a situation that might require immediate action for a child, a teen, young adult, or even anyone, psychiatrically, mental health speaking? Anybody? Any ideas? A lot of people will ask me about suicide, self-harm, things like that. Those can be considered red flags and should be taken extremely seriously. People will ask about in what way to talk and approach teens, young adults. And I usually say start off by a kind word or just checking in and asking how they're doing, even if you get like a kind of a response. Let them know that you're there, and if they want to or need to talk, you're there. Be consistent. But some of the things that we talk about that require emergency intervention, similar to anybody that has any kind of medical emergency. Psychiatric emergencies are medical emergencies. If someone is talking about suicide, someone is self-harming, someone is completely out of the normal for what you would normally see for them or what you would consider to be normal for their age or developmental level. Those kind of things, stark changes in behavior or harm to self, harm to others, are things do not overlook and require immediate emergency attention. Nearest emergency department, we say, make sure they get all the information evaluated, and we take them as seriously as any other medical emergency. Other times, I think kids and teens, like I said, just need a kind and encouraging word, and not a bunch of words, but just a kind, encouraging word to know that there's somebody asking and somebody concerned and wants to know if they're okay. And if they're okay, that's good. And if they're having trouble, maybe they can chat a little bit about it. And then everything in between those. Kind of just being mindful and watching, and if there's something in yourself that's telling you somebody, especially a kid, teen or young adult, is having trouble, if there's something in you that's saying, something doesn't seem quite right here, to take that sort of inkling within yourself seriously too. And if it's nothing, it's nothing. But sometimes it might be something. And I think God leads us sometimes to have that feeling and to take that opening to potentially help heal someone and make an eternal difference in their lives. Other kind of levels of care between just a kind word and the emergency department, all different kinds of things. I often tell parents, other concerned adults, to start with the normal places you would start if a child or teen would be having difficulty or having trouble. Start the primary care doctor, start with school or other resources, with a faith organization, and ask for help, but also look into who the trained professionals are appropriate. If you need a specific surgery, You need to go to a specific sort of surgeon and be evaluated by practitioners that practice in that area. The same is true for psychiatric illness. So it could be just presenting to a primary care doctor and asking, having them refer. It could be having school counselor take a look, having them make a referral. Services for kids and teens have always been hard to come by for psychiatric needs. Child and adolescent psychiatry has classically been one of the most, if not the most, underserved areas of all of medicine, including primary care. And those issues are continuing, and with the influx of severity of psychiatric illness and the number of kids and teens needing support, that's no better, and we're even more behind than we used to be. And finding appropriately trained therapists and other counselors can be tricky, but it is important to search and try to find help and ask normal places you might start, as well as ask professionals and ask others. And like I said, and I'll kind of underscore something that's very important to me, I'll talk a little bit about mental health parity, is that psychiatry is part of medicine in general, and to take anything, whether it's mental or physical, to me it is all one thing. There's not a separation magically at your neck. And it can overlap some with other illness, psychiatric issues causing other illnesses. And it's important to understand that there still is a great stigma that surrounds mental health, psychiatric illness that exists, and can make it even more difficult for kids and teens to ask for help. I think that we're in a better place than where we were. We're in a better place than where we were when I started training, but we have a long, long way to go. Additionally, I guess the difficulties that we're building prior to the pandemic have just mushroomed. There are additional difficulty that adults of all ages have experienced as far as emotional well-being, as well as medical professionals. Even myself, just sort of the exhaustion and burnout and things, and I think all of us continue to have, probably related to at least some part of what we're dealing. Even all these things, depending on your views, it's still stressful. No matter what your view is about this, it is a stress, undeniably so, and it's a changing stress. So it's not just there, it just continues to change, and it can, some of the supports that we may have had in our community, within our families and things, are broken down, and we have to work on healing some of those and understanding. What we do agree on is that our world is stressed. We are stressed. We've been impacted, and how can we work together on the things we can agree on and heal? In sort of another verse that's important to me, that we think about each other, kids and teens, but also those who may not have access, socioeconomically, racially, all kinds of different reasons why certain people don't have access to the care that they might need or other things that they might need. And so Matthew 25:40, truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me. And that's something that's very important to me, to make sure that no one's missed, because we're all God's children. So that being said, I think it's important too to have our minds open, but also our hearts open to possible needs of our fellow humans, and in a without judgment sort of way, because none of us is perfect. And like I said, our world's never been through something quite like this. So our ability to navigate is based on the little bit we know from the last couple years, as well as what we know from previous things. But some of it we're gonna not get so right, and some of it we're not gonna have, this is how we did before, so this is how we proceed, because we don't have that information and we don't have that experience. Like I said, ask questions if things look okay. Don't assume everything's fine with everyone. And if someone's willing to share, and if they share things that feel like red flags or you're not sure, it's important to access help as soon as possible. Like I said, primary care physicians, schools, other supportive community organizations, but there are also some different things that I'll share at the end and take you to a couple websites that have resources, but also different links and things to click on for answers for parents. One's the American Academy of Pediatrics, and the other's an American Academy of Child and Adolescent Psychiatrists. It has lots of different links of all kinds of concerns that parents, care providers, and concerned individuals can click on. Like I said, some of it can be normal reaction to the different world that we live in. But I think part of what's important is to come together as communities with what we do agree on. I think most of us can agree on that our kids and teens and young adults are very important and they're the future of where we're going. Even though a lot of things that we've been guided to do are sort of a changing target, there's many different opinions, but whatever we do, we're called to be a light, and there's a role I think each of us can play regardless of whatever level of expertise we do or do not have. So some of the things that we will talk about in levels of care is accessing a guidance counselor or someone, your faith community, or other sort of community organization to ask for help, to share concerns, as well as physicians. And then if there is a concern identified that seems like it may need additional care, we look for therapists, outpatient ongoing therapy with licensed social workers who have experience working with kids and teens, family therapists, licensed psychologists, depending on the age and what's needed. Some of the things that we talk about that are research proven are things like CBT, cognitive behavioral therapy, so mindfulness, simple things like taking deep breaths before we kind of lose or have things fly out of our mouths, saying things in a kind way, saying, I don't know, this is what's going through my head right now, what's going through yours. But if you don't know what to do, accessing help through someone that is a trained professional. And it's important to have different kinds of therapy and interventions. There's also what's called DBT, dialectical behavioral therapy, interpersonal therapy, a few different kind of things that are research proven. Some of the important things just to look at when finding a therapist or somebody for a child, teen, or young adult to work with would be being able to create rapport and have a good connection with that therapist, but also an ongoing plan. Therapy just shouldn't be let's sit and chat it up. There should be a plan, there should be a purpose, timeline, things we're going to work on, often depending on type of therapy, sort of homework, the process through, and shouldn't be let's meet every 3 months. It should be let's meet every couple weeks at least to continue an ongoing therapy. And then sometimes illnesses and things will require medication, which can be prescribed by primary care physicians, but also sometimes needing referral to a subspecialized physicians, child and adolescent psychiatrists who are medical doctors who will see kids and teens and prescribe medications. And some people get very scared and sort of worried about that, and certainly we don't want to have anyone have more medication that is needed or necessary, but I often explain it to, like, allergies or asthma. If you live in an area that doesn't trigger your allergies and things, you can kind of avoid pollen, do other things. But you live in an area or season that you're really wheezing and having lots of allergies, then you probably need to think about medications. The same is true for psychiatric illness, depending on how severe it is and what's going on. Sometimes the proper thing, even for children, is to try out some medication with a properly trained professional. And different levels of care. Hospitalization, there's a lot of stigma and a lot of ideas that go along with hospitalizing somebody on a psych ward, so a psychiatric inpatient hospitalization. But as with any kind of hospitalization, especially for kids and teens, you never want kids or teens to have to be in the hospital for anything. You want them to be healthy, well, out being a kid, out being a teen. But if the illness and level of disease or disorder is to the point needs inpatient hospitalization, that's what needs to happen. And people a lot of time have ideas that kids will be put in straitjackets or it'll look like the movies and those kind of things, which it is not. But sometimes things will get that severe, and sometimes that's what needs to happen. We hope that we can get kids and teens into the appropriate services in time so that things like that don't have to happen. So we have other levels of care, things called partial hospital programs or day programs that are during the week, during the school day. And then other levels of care, like I said, outpatient therapy, following up with a child and adolescent psychiatrist, school-based resources, lots of different kinds of things depending on what's needed. In-home family-based resources, behavioral specialists can be involved, and different things can be accessed through private insurances, but also if the illness meets criteria, through state insurances too, regardless of financial concerns. If the illness meets criteria, there's some access to resources and support that can be helpful. So those are important things to keep in mind. One of the other things too is we've seen an uptick in suicide and self-harm. Also, children that have neurodevelop.
In normal times, I would expect that referrals for you largely come from school-oriented things, or from teachers, I would expect less so from other students, more so than from parents. I think as parents we tend to assume everything's okay, but I would think that teachers would have a better feel for that. Is that a correct assumption?
It sort of depends. We get referrals on an outpatient, but also even, I would say, acutely in the emergency department. When I'm called down to see a patient for a consult, does this child, are they in emergency crisis risk that we have to search for inpatient psychiatric hospitalization, and to outpatient referrals. So there are times definitely that teachers, counselors, principals will notice something and say, hey, and we'll make that referral. There are sometimes the parents will notice something and make a referral, and then oftentimes primary care doctors. And one of the things we're trying to do, and I think where some of our profession is going as psychiatrists, is to support our primary care doctors to help recognize and help treat some. But we do get a lot from schools, but we do get some referrals from parents. Also children and teens, depending on what they've heard at school or from classmates or things, will tell a parent, will tell some other caregiver, I think I need help, you need to talk to somebody, I think. And I think this is part of some of what's changed, that I hope it's continues to be more and more considered okay, appropriate, and you're supposed to ask for help when this part isn't going well. The same as if you had a terrible headache or awful bellyache, if this part of you is hurting.
Yeah, kind of why I asked since I consider them the primary source, we've kind of taken that all away.
Mm-hmm.
So the teachers have disappeared, their contemporaries have disappeared. So a big piece of your information just disappeared.
Mm-hmm.
So
Mm-hmm.
the job got a lot harder.
So yeah, things are a lot trickier, and that being said, a big piece of support for kids and teens that is part of their natural world and part of the natural experience of growing up has been taken away because they don't have that social support and they don't have that school support. And social support, school support go hand in hand too. And some of those other built-in, I guess, people that can raise their hand and say, hey, I think something's wrong here, have also sort of been taken away. And even going out in your neighborhood and knowing individuals in your neighborhood, those kind of things, everybody isolated and kind of apart, some of those sort of build-in community things. Kids would be in different sort of activities with other adults, lots of other kids, even some of those built-in things have fallen off. So it gets really tricky. And some of those supports that would otherwise be able to catch some kids that were having some difficulties, but provide that support so that we can kind of do okay and go on, those aren't there, and so kids continue to get worse and very ill too. Thanks for that question, I appreciate it. So one of the things we've seen an uptick in suicides, self-harm, anxiety symptoms, depressive symptoms, as well as kids with neurodevelopmental disorders that may have underlying difficulties, autism spectrum as an example, those kind of things with any sort of change in their environment. And now everything's always a changing target to some extent and can be very hard for certain individuals to deal with, and so we have to be extra sensitive to that. Additionally, things that kids and teens can struggle with, we've been seeing a lot more of are eating disorders, those sort of things. The supports for patients, like you said, schools, social supports, other things, even check up with pediatricians and things. People have gone for a while because of the pandemic and having normal checkups. And kind of feeling out of control of things, either we're told exactly what to do, when to do it, how to do it, or everything feels completely out of control because we don't know where COVID pandemic is going to go and how it's going to affect, and we think one thing and then something else, and we really don't know. So that sort of control has been lost. So disorders related to that, we've seen somewhat of a spike in those as well. And I think in general, families just experience a lot of big emotions related to things. And hopefully realizing, even us as adults, if we're having issues, that if we need supports. It's one of the things I'll talk to parents and adults that are supports for kids and teens and young adults, is that we have to take care of ourselves within ourselves in order to be able to take care of, we have to be filled up in order to be taking care of others. So we need to realize and access help when we need it. And some other things are language to use with kids and teens. Like I said, a listening presence, being open, being willing to learn from the language in ways that they talk, and new words that they're using, new places they're going for information. It's a continuing process that is difficult to keep up with, but just ask them, like, what's that? Is that a new thing? Like, oh, okay. And ask them what words they're using. Another thing has been this increase in social media and those kind of things, which we know, depending on how it's used, can be not the best for our kids and teens. However, in some ways, connections need to be made and social supports need to continue. So that's always a question about social media, electronic use, and what kind and how much, and what our kids and teens are being influenced with. So it's important to monitor that, allow our kids some access to technology, but not something that's not age inappropriate, and something that they don't need, to encourage in-person social interactions as much as able and possible within the realm of what we're dealing with COVID and the current circulating virus, but also allow some of those conversations and interactions to take place in other ways too. Video chats, things like that. Let's see here.
On that point,
Yeah.
I know you and I have had many discussions on
This is my husband.
electronics use and how much is too much, and the nights edge we're on a daily basis even for, okay, well, we have to do schoolwork, but if we can't do schoolwork with friends, you know, it makes the burden on the parents, and then the parents are now torn between work, from remote working to doing schoolwork. Like, I guess, where's normal in this whole thing? And we talk about the new normal, or what is normal for each, you know, family is completely different from someone else on a socioeconomic level. You know, I have the device, my friend doesn't have the laptop. You know, we can't talk at all. I lost my friend. You know, or, you know, normal for us, you know, a 9-to-5 job is not in the realm of possibility for us anymore. You know, like, I don't know, what do you see in your dealings at Hershey as do you see everyone struggling, or is it disproportionate to one side or the other, and the struggles that you're seeing?
I think everyone has struggled within their families to try to figure out what is most important. Trying to navigate balancing schoolwork, academics, important social interactions, important family time. How do I keep doing my job while trying to be my kid's teacher when they're learning at home? I think that everybody is struggling, and that's something I continue to keep hammering, that we're all in this, we're all having issues. And one of the reasons why I say, I talk about, the perfect Facebook persona. I think that there should be like a day everywhere that one day a year that everybody posts on Facebook, like this is the worst day our family's had this year, or everything, the chili spilled out of our refrigerator, everything was a mess. Like, that we're all human and we're all struggling, and we're all struggling a lot right now within our families to figure out what to do with our kids, with our teens, with our grandchildren. With teachers are struggling to do the right thing and educate our kids. We are too. Where's the level of helping them be social with electronics while cutting off, not having them spend all sorts of time on it, and not having them have access to a phone when they're really young because they don't need that, or access to age inappropriate sorts of things. And one of the things I talk about a lot is, academics and learning is very important, but there's a ton else that goes into schooling kids that is not an academic learning process. And those things have gotten lost. So there's a balance between, yes, you want your kid to be doing the best academically, but that is not the only thing. That, if your child is scared to go to their classroom because it's been forever, and the social skills that they used to do okay with have now dropped out, we kind of need to focus on that. And if the academics, we'll get there. It's harder to relearn social skills at different developmental age. It can always, a little bit easier sometimes to relearn math facts, things like that. And I think it's a balancing act too, and a balancing act that we're all going to get wrong at some point, and recognizing that. But also a balancing act that you keep checking in with people that might know, asking people, and also asking your children and teens, like, what's going on with you? Like, why this, why that? Or like, hey, can I have your device to see what you're doing? Tell me about what is it that this thing that you're playing. Like, tell me about how you guys interact and what it is that you do, because I don't understand. I tell kids all the time, like, I'm terrible at video games, but I'd love to know what you're doing and what you're good at and why you play that game, and do you talk to your friends on it, or all those kind of things.
Something I noticed, and it's, I work with the nursery a lot, plus I just, my history with young kids, is that the 2 and 3-year-olds that we have now are still in the parallel play stage rather than the social play. Like, they're playing the same thing, but they're not playing together.
Yep.
Like, they all have dolls and they all have the food out.
But they're not kind of progressing developmentally where you think that they would be or normally would have been.
Right.
And
Now they will play with the adults more.
Yep.
Like, they want the adults to sit there and they'll play where they're making food for the adults, and they're, talking about their doll babies, or they want to be read to, but it's not with their peers.
Yep.
And at this stage, normally there'd be some more peer play.
I think you're absolutely true, and we're seeing some of that because they've kind of missed this social part of their development. There's a chunk out. There's a chunk missing. And so providing opportunities, and kids' brains, and the way we lay down neural tracks and then prune and continue to sort of prune until our mid-20s, and kids and children's brains being, very malleable is a good thing because they can catch up. But it's important to understand they have missed a chunk of social and emotional growth that goes with that. Even how more difficult is it to tell my emotion? Like, even recognizing faces and people we know. I'm like, hi, is that? Oh yeah, it is you behind there. Things like that. It's difficult, but it's true for that chunk of time for each kid that's been through it. Each part of that.
Read social cues, like,
And that's very true.
because, unless you have very expressive eyes, that's still just part of it. Because I know from years of teaching, you could control a classroom's behavior sometimes with just,
That you can't do right now. It's like,
now seriously, it's not as easy to just give them the little no-no sign.
yeah, that's true.
And just different things, and I have that's just very concerning. And then I think because the kids want all the adult attention instead of their peer attention, the adults get tired.
Yeah, it's true. And we have to kind of be working extra hard to get those kids that have lost some of that social development. We have to work extra hard to help them gain it back and get experiences to gain it back, and to develop that.
Do you think, like, over, like, when you say, like, it's been 100 years since the difference between the Spanish flu, too, would be families would have been larger?
Yep.
So there would have been more siblings to interact with, and families were more centralized. Like, you live next to your cousins, you live next to
Yep.
your family, where here we don't really.
Absolutely, and it is a different sort of loss. There would have been more death, potentially, but this idea of isolating so that we all can stay healthy from getting the virus then sets us up for those other losses, like those social emotional supports. Even us as adults have missed that chunk, have lost some friendships, have lost those supports. What we've experienced and the level to which we've had to isolate. But there are big chunks of development. The good news is the kids can gain those back, but we have to be very cognizant, like you are being, that it is different. And we may have to use other creative ways and resources to help them gain those certain sections of development. And those sections of development, that social emotional development, is one of the most important things to grow up to be a proficient adult. Like you can even learn math facts in adulthood. Not to say that, the core education and core learning isn't needed, but we just focus on that and all the rest of things that schools provide for kids, and just being out in communities provide for kids, and also that other network or net of support has gone. So we kind of have to do as much as we can to the level we can, and just be aware that this part is lost and what do we need to do. And so that kind of is one of the things with mental health psychiatric parity, meaning that other sorts of medical illness is seen as different than psychiatric illness. The stigma that goes with it, also payment, insurance are split, which is absurd. And all of that is something that, and the kind of supports you're talking about, developmental resources, speech therapy, social skills training, all those kind of things are under my sort of, what can we do other than the people around us and accessing support and making sure people are getting to the professionals they need to, is advocating for resources, for monies, for the powers that be, I guess, to realize you can no longer overlook this. You shouldn't have been in 2018 when it was the second cause of death from about 10 to 24-year-olds. And you cannot overlook it now. You cannot. And advocating and knowing this is an issue and a problem, and it has to be taken seriously because it's going to affect all of whom we are as people, as society, as a world. And I have some things. Let's see if this is. So that's one of the things the Surgeon General's report that you can access. And I think as far as sort of being a general thing and not like guiding you into research articles and things is this one. And that's one of the graphics that I think is helpful. It talks about different things. One of the other things is the American Academy of Pediatrics website. They have some nice resources on all kinds of different things for families related to COVID-19 and lots of different things. Is a good website, and a website, another that just is the American Academy of Child and Adolescent Psychiatry. There's a lot of different things and resources in the ACAP library that you can go to. And it has tons of different things that you can click on. All different kinds of topics, from grief to tools to talk to your kids about anxiety, different screening, education, all kinds of different topics based in current research or just guidance, guidelines, a comic and how to talk to your kid about COVID, like lots of different things. Some of the other things I'll talk about is using in Pennsylvania our county crisis. So whatever county you live in, there's a crisis number that you can call 24/7 and talk to somebody, and they can help assess your crisis situation if it is a crisis, and if it is, assess and send someone if you feel like somebody is in crisis. There's also national suicide hotlines and things like that, but one of the ones that I kind of like is Teen Line to use, that anywhere you have access to the internet, or if you even know Teen Line, there's lots of ways a teen or anyone of any age, you can get resources, log on, call, chat, talk, all kinds of things. And that's an easy one often for teens to remember too, Teen Line. So I'm old, and so when I first started, the things I would tell them to write it down, put it in their pocket, put it in their purse, whatever, wallet. Now, of course, I just tell them to put it in their phone or electronic device or whatever. But that's but any sort of hotline. And I talk about, if you ever feel this way, as well as if you have lots of hurting yourself severely, not wanting to live, wishing you were dead, not born, thoughts of thinking you severely hurt someone else, hallucinations, things just seem weird off, not right, or along with the same lines as somebody hurting you, harming you, mistreating you, doing things to you they shouldn't, abusing you, touching you inappropriately. These are all times you absolutely must let an adult that you trust know. And just like reiterating that those are important times, and those are times you're supposed to let that adult you trust know, just like if you have a terrible headache or a terrible bellyache. Those are the same level of I need help. Any other sort of questions or comments? Yeah.
Just, I'm always baffled by how long it takes to get a child help.
It's terrible.
Once they're identified in school, it can take up to 9 months if you're lucky. But
It's
then
terrible.
the
It's awful.
school year starts and they start the whole process over again.
Yep.
And also just
Even to get in with a therapist. Yep.
like you either have to be very wealthy or you have to be on public assistance to be able to afford the care for your child, unless it's like an emergency.
Yep.
When I worked under a state grant, we'd have people call and say, well, my child's been kicked out of child care again for the 10th time. I'm on a waiting list to see the psychiatrist. They're doing everything right. And I remember listening to one woman who wasn't in my area, so I didn't really know all the resources for her. And I listened to her for 45 minutes just because that's what needed to happen, and
Yes.
and finally she said he threatened to kill his teacher and kill himself, and I'm like, oh, go to the emergency. I was like, it was like that amount, like she had to say them severe words for
Yeah.
me to have a place to send her.
Yep.
Which was awful, that it had to be to the point where the child was going to hurt someone and themselves for me to have
Yep.
a resource for them.
Yeah, it's
And
awful.
I felt bad because all the things she named that she was doing, but was on these waiting lists.
Yep.
were
If
all
only we
these
could
things
have had those start,
to help her.
we wouldn't be where we are
Right.
with a child being that ill.
And I just remember, that just has stayed with me all these years, that I had to wait till the woman said them words for me to say,
Mhm.
here's what you need to do, because they will put him in a hold right away, at least for a little bit, and maybe be able to speed up the resources. Not a guarantee
Nope.
that the
Yep.
resources would be speeded up, but it might be a guarantee.
Mhm.
It's just
It's terrible. It's awful. It's unacceptable. I've been on the soapbox for years, and now it's even worse. And that's I live that daily at work, and it's unacceptable. There's no other child that comes into emergency department that ill that we say, we don't have a resource. You're too sick for us. You're too sick for the psychiatric hospital to accept because you have so much stuff going on. There's so many patients that you're going to have to wait even longer. Is there any other patient that comes in that ill that we say you're too sick? Or you got to wait because we don't have enough? No. And it's correct. And I think that that's where, as a society, as a faith community, that we can do better. And we have to do better. Or we are losing kids and teens, and we're going to lose more, and our society and who we are. And I believe, God has called us to do it. But I also, one of the last verses, Hebrews 13:5, he says, never will I leave you, never will I forsake you. So even in those moments, if you walk through personally or with someone else, God is there. And that's something I think that we have to remind ourselves and remind others that you are not alone, depending on, you know, what their faith background is, depending on how you talk to them. But that I hear you, and you are not alone. You are not. And there are many who care, and you can get better. You will get better. So, but that's hard. Absolutely. Any other questions? Anybody from, I don't know, from live stream? Okay. I'll end in prayer. Are there any specific prayer requests related to this or other things? Well, thank you all for being here, and if you have questions afterwards, let me know. Lord, thank you for the time to talk about these important things, and for the questions and the ability to discuss and talk about hurting children and teens. But thank you also for your promise that you will be there. Play a blessing on our children and teens and our community and our state, our country, and our world. And that you would lead us to know where we go and how we help, carrying your message of love and salvation. Amen. You're welcome.
Maybe you could put together a PDF that we could include with the
Yep. Resources?
resources.
Absolutely.
With the actual presentation.
Mm-hmm.
Because I think that while it's fine to see the links on the screen,
Yes.
you know how hard it is to read the links.
Mm-hmm.